Hello, everyone. Good evening again from Manila. It's 6 p.m. once more, and we are about to begin the seventh session of the Southeast Asia Climate and Health Responder course brought to you by the Global Consortium on Climate and Health Education, based at Columbia University's Mailman School of Public Health, the St. Luke's Medical Center College of Medicine, William H. Quassia Memorial's Planetary and Global Health Program, and of course, healthcare without harm here in Southeast Asia. Again, I'm Dr. Renzo Ginto, the director of the Planetary and Global Health Program at St. Luke's, and I will be moderating this session. Today, again, as I've mentioned, we will be focusing on how can healthcare systems be adaptive and resilient to the challenges brought about by climate change. Last week, on Thursday, we learned about how to lower the ecological footprint, the carbon footprint of the healthcare sector through mitigation actions, through sustainable healthcare. Today, we will be talking about how to make sure our health systems do bend without breaking in the face of climate-related disasters and other health impacts of climate change. Before I introduce our main speaker, I would like to remind everyone to please keep yourselves muted and also your cameras turned off. And later on, I will be reading your questions and comments in the chat box. So please make use of the chat box. I don't think this group actually needs any reminding because for the past 6 sessions, all of you have been very active, participative in using the chat box. And I'm very glad that from around 600 participants, live participants during the first session, we still have 185 and still counting in this 7th session. So hopefully we'll beat the 200 mark or even the 300 mark in this session, and we'll continue to do so until the last session on Thursday, until you all receive the post-course survey and eventually your certificate. So now let me call on our speaker for today. She is the Regional Climate Manager of Healthcare Without Harm in Southeast Asia. Our speaker will be again talking about adaptation and resilience in the health sector. Let's all welcome Ms. Jit Sohal. She's joining us from Dili, East Timor. And to make sure that there will be no internet interruptions, she sent to us a recording, and later on, she will be joining us for the Q&A. So, Raisa, maybe we can now play Jit's lecture. Thank you. Raisa, can we rewind again the lecture, please? Thank you. And there's no sound, unfortunately.
What about now?
Hello, everyone. Good evening, good afternoon, good morning.
We can hear her now. Thank you.
Perfect.
I am Jit Sohal. I'm the Regional Climate Manager at Healthcare Without Harm Southeast Asia. And I am based in Manila, Philippines. But I am currently in East Timor for a project that is very much related to our topic today. And something that I will mention in this presentation as well. And because of connection issues, I am pre-recording this presentation, but I hope to still be able to join you for the rest of the session live. Let me share my screen. All right, perfect. So again, we are on session 7 of the Climate and Health Responder course for Southeast Asia. And our topic for today is the second installment of the Climate Smart Healthcare, which is adaptation and resilience. These are our learning objectives for today. Last week, Ramon, our executive director, talked about mitigation and sustainability with all of you. In today's session, we'll focus on adaptation and resilience. In our session today, we will delve into 5 key topics or themes. Let's explore the what, the why, and how of resilience in healthcare settings within the context of climate change. Additionally, we will also examine some of the measures that Southeast Asian countries have already taken or currently taking, while also exploring the vital link between health equity and resilience. So I hope that by addressing all of these aspects, together with a very interesting case study presentation that you will hear later today, I hope that we will be able to achieve our learning objectives for this session. So let's start with defining some of these concepts that we have been hearing all throughout this course, and concepts that are very much important for this session. I invite each of you to engage in the chat and share your personal reflections on the word resilience. So please express what resonates with you the most when you hear this term. I want to see, well, although not really during the recording of this session, but I want to see what comes out as the most popular term for you. And feel free to engage with others in the chat if they have similar or really interesting expressions of resilience. I'm guessing that words such as adaptation, coping, transformation, maybe even bouncing back or preparedness are some of the words that are coming up. And I'm sure that you guys have amazing personal definitions of this word. For me, when I think about resilience, 2 particular words come to mind a lot, and that's community and justice. It is intriguing to observe how resilience manifests differently in various contexts. In the Philippines, for instance, there has been a tendency to label Filipinos as resilient when they endure natural disasters and they continue to smile in the face of adversity. It was portrayed as a positive thing, and even politicians have sometimes overused the term, mainly directed to the very poor and vulnerable communities. And it was sad because in reality, this portrayal of resilience merely means enduring suffering. And people continue to suffer disasters on top of disasters, most of the time without any meaningful solutions. And this perspective of resilience casts a shadow on the true essence of the word. And when we talk about the technical definition of resilience by the IPCC, as you can see, it extends beyond coping. It's also about maintaining your essential function, identity, and structure, while fostering the capacity for adaptation, learning, and transformation. So this definition emphasizes the dynamic nature of resilience, which involves the ability to adapt to changing circumstances, acquire new knowledge and skills, and also undergo that very important transformative process. And there are some instances that adaptation will be referred to as synonymous to resilience. They are related, but really different terms. So adaptation primarily focuses on the specific adjustment, so that's the keyword, implemented to address the impacts of climate change. So when we talk about adaptation in public health, sometimes it's referred to as prevention. And various adaptation types exist. Probably you've heard of anticipatory adaptation or reactive adaptation. So this adaptation responds to immediate threats of climate vulnerability, usually commonly addressed with disaster risk reduction or emergency response, but also seeks to identify and plan for large-scale risks and trends posed by long-term environmental and climatic changes. Resilience, on the other hand, to climate change goes beyond just adapting to those changes. It usually requires a capacity to anticipate climate change and plan those needed adaptations. It involves the capacity to bounce back from disruptions, learn from experiences, and transform in the face of adversity. So those are probably some of the terms you have mentioned earlier: bounce back, transform. And so I see resilience as the ultimate goal, and kind of the adaptation is kind of the process of getting there, one of the processes of getting there. So therefore, while adaptation is a crucial component of resilience, resilience encompasses a more comprehensive set of characteristics and capabilities that go beyond adaptation alone. And when we talk about adaptation and resilience, we need to also be familiar with the terms in this graph, which is probably something you have seen before. This is IPCC's climate change adaptation framework, which where risk is a function of hazard, vulnerability, and exposure. You will see this throughout the presentations. Hazards are those natural and human-induced physical events brought about by climate change. So it can either be typhoons, drought, heat waves, wildfires, and then exposures, on the other hand, from the point of view of healthcare, relates to the presence of healthcare workers, patients, services, and infrastructure where in the location of the current or future climate hazards. Vulnerabilities are, as you know, conditions determined by physical, social, economic, and environmental factors or processes which increase your susceptibility to the impact of hazards. So this means vulnerability means that it extends beyond climate change and may exist before a hazard manifests. However, climate change stress or shocks may increase vulnerability over time by also impacting on other social, environmental, and economic factors. In the Philippines, we have, in the Social Welfare and Development Department, we have what we call poor and near poor. So I would share a little bit about how vulnerability and climate change increases vulnerability over time by sharing an example of how climate change impacts near poor population in the Philippines. For example, a disaster strikes, those who are near poor or those who are not really below poverty line but are slightly above poverty line, when a disaster strikes, they lose livelihood, for example, or they lose their house, and one of the members of the family also is lost or impacted by the typhoon or the disaster. That family gets pushed into poverty sometimes and gets pushed below the poverty line. And that's how I would see climate change also exacerbating or increasing your vulnerability over time. You're not necessarily poor, right, in technical terms, but because of a disaster, your vulnerability then gets impacted and increases because of that specific disaster. Risk is explained as a function of those three things: hazards, exposures, and vulnerabilities. In other words, risk depends on the occurrence of a hazard, exposure to those hazards, and the vulnerability present in that system. Climate change risk is the likelihood that climate-induced shocks and stresses will adversely impact the functioning of a healthcare facility, for example. So that impact on the facility will vary depending on the intensity and magnitude of a specific hazard, the level of exposure to the hazard of the healthcare facility, or the staff, or the communities, and the level of existing vulnerability, which will determine how much these hazards will impact the healthcare facilities functioning. Impacts, on the other hand, are consequences of those realized risks. So in the context of healthcare, to reduce climate change risks and possibility of these impacts, healthcare facilities need to be resilient. I'm just showing you, and if you get a copy, once you get a copy of this presentation, you will see these definitions also included in the presentation for your reference. And I'm going to show you 3 maps from a study done in 2009 in Southeast Asia. This first map shows you the hazard hotspots in Southeast Asia. And as you can see, Philippines, some parts of Indonesia, some parts of Vietnam, and Malaysia are some of the most at risk of these hazards. These hazards, particularly cyclones, floods, droughts, landslides, and sea level rise. So my country, the Philippines, is top 1. And then you go to vulnerability. And again, vulnerability is the your social, economic, physical, environmental conditions. And this can exist even before a hazard manifests, right? So this vulnerability map shows you that the most vulnerable also in Southeast Asia are all regions in the Philippines, the Mekong River Delta in Vietnam, almost all the regions of Cambodia, North and East Laos, the Bangkok region of Thailand, and then you have West Sumatra, South Sumatra, West Java, and East Java of Indonesia. And then the last map that I'm going to show you is on adaptive capacity. So this is the ability of the systems to adjust, right? As we learned earlier. And this is in 2009, based on that 2009 study, the adaptive capacity of Southeast Asia region. And you can see those with relatively high adaptive capacity are Thailand, Vietnam, and Malaysia. And those with relatively low adaptive capacity are Philippines, Cambodia, and Laos PDR. And so I know that you are aware of all of these unique challenges that our Southeast Asia region face. You have been learning a lot for the past 6 sessions, and we know that our vulnerability to the impacts of climate change poses significant risks to the health and well-being of the population. You learned about all the diseases, infectious diseases, non-communicable diseases, mental health, impacts of climate change on human health. But these challenges also make it have an impact on healthcare systems and facilities. We are very familiar here in Southeast Asia, and we have seen in the past how extreme weather events have revealed the vulnerability of healthcare systems and the extent of devastation to communities when they fail. COVID-19 showed us that. Climate change threat, the threats of climate change to health systems are particularly disruptive for vulnerable individuals and communities when they affect healthcare facilities, because it has the potential to cause significant damage to infrastructure, disrupt health services. Roadblocks may limit the accessibility of supplies. Essential services needed for running the facilities, such as energy and water supply, may be interrupted, and patients' accessibility to health facilities may be obstructed. You also have populations being displaced, leading to increased health risks and many more. These are photos of health centers in Cambodia that are highly exposed to hazards such as typhoons and flooding. Many of them are located in areas with high frequency of typhoons and flooding. And so are other parts of the region, including the Philippines. A case in point in the province of Dinagat Islands in the Philippines, in Mindanao, back in 2021, December, Typhoon Rai, or local name of Typhoon Odette, hit the province and affected more than 90% of the island. So the destruction of boats, ports, and other transport services meant that for a few days, they had no immediate access to relief from the rest of the Philippines. And so their immediate concerns after include access to food security, access to clean water, sanitation, shelter, and of course, the continuity of health services, since most of the hospitals and healthcare facilities were affected by the typhoon. So the lack of access to these basic necessities led to immediate and long-term health consequences. The increase of incidence of acute malnutrition in children less than 5 increased dramatically, almost doubled after the typhoon. They saw outbreaks of various infectious diseases, COVID-19 due to people's lack of access to shelter and ability to isolate if they were experiencing symptoms, lack of access to any testing and quarantine facilities. And then you have acute gastroenteritis due to the lack of access to safe drinking water. People in the Nagat Islands died because of this, not necessarily directly from the typhoon, but because of the lack of access to clean water immediately after the typhoon. And then you have the long-term effects on health, the increases in chronic conditions, chronic morbidities, lack of control of these conditions such as hypertension and diabetes, for people who were unable to access their routine healthcare services, who were unable to go to their community health centers or ask for their maintenance medications, unable to see their physician due to lack of transportation. And then, of course, you have the mental effects on the entire population, including health workers. So really what we have been learning for the past 5-6 sessions of this course, I would say the Nagat Islands actually experienced them during Typhoon Rai in December 2021. So it's so important and necessary that our healthcare systems are resilient to climate change, because when they're resilient, they're able to adapt to those changing conditions. And also, not just because we are able to provide and continue providing care even during disasters, but also because we know when we have resilient health systems and facilities, we are able to influence resilience of communities. And by building healthcare systems that can withstand and respond to climate challenges, we create a foundation for improved community resilience. When healthcare facilities remain functional and accessible during extreme weather events or other disruptions, they provide a vital lifeline for communities in need. Access to healthcare services becomes particularly critical in times of crisis, when the health impacts of climate change may be magnified. Furthermore, climate resilient health systems prioritize the needs of vulnerable populations. By addressing health disparities, ensuring equitable access to healthcare services, these systems actually promote social justice and contribute to the overall resilience of communities. That's why when I think about resilience, it's really about community and justice, and recognizing that climate change disproportionately affects marginalized groups. Resilient healthcare endeavors to bridge the gap and provide inclusive care for all. So how do we actually do this? How do we achieve climate resilient healthcare? There have been numerous approaches and tools developed to address the challenges and promote climate resilient healthcare. We're going to try to briefly explore some of these, but know that there are others out there, and these are the things that I'm going to mention, approaches and tools that I'm going to mention today are those that are most widely used by Southeast Asian countries. These are WHO frameworks and tools for building climate resilient healthcare. We have two levels, the system, national level, and facility level. At the system level, you have the operational framework for building climate resilient health systems, released in 2015. And I'm sure you're mostly familiar with this, the building blocks of climate resilient healthcare. And it has a complementary tool for national governments on conducting vulnerability and adaptation assessment at the system level. And then at the facility level, you have the guidance for climate resilient and environmentally sustainable healthcare facilities, with its complementary tool for assessing vulnerabilities in facilities, both released in 2021. So these are all guidance documents, and they are meant to support and be adapted to local realities and requirements. And that's something that WHO has stressed in all of these documents, that these will need to be contextualized to the local conditions and situation, whether at the country system level or the facility level. This is the building blocks of health systems, right? I don't know if you are familiar with these 10 building blocks, but this is from the WHO operational framework for building climate resilient health systems. And as you can see, WHO adapted the same definition of resilience for healthcare, and that's the capacity of the system to cope with and manage health risks in a way that we are able to maintain essential functions, identity, and structure. And all of these building blocks, some of them will be more important in some countries, some of them will not be as important to them, and then so that's why WHO reiterates, and something that I want to make sure we know is that these approaches are there to guide us, but they need to be contextualized and adapted to the context and situation of the country we are using the approach for. So this operational framework talks about the 10 building blocks of leadership and governance, health workforce, climate and health financing, emergency preparedness and management, climate-informed health programs, management of environmental determinants of health, climate resilient and sustainable technologies and infrastructure, health and climate research, integrated risk monitoring and early warning, vulnerability, capacity, and adaptation assessment. So all of these components or building blocks of health systems are important to be able to build climate resilient healthcare. But later on, we'll discuss about the journey, an actual journey of healthcare facilities and systems to actually get there. And one of the most important building blocks, whether it is on the system side or facility side, is the vulnerability and adaptation assessment. And this is important because it's able to help you as a system understand the health impacts from current and future climate hazards, understand which populations and areas in your country are most vulnerable to those impacts, and understand the current capacity of your system to manage those health impacts, and then identify gaps in terms of policies and programs. So after you do all of these assessment on vulnerability and adaptation, you're able to identify and prioritize what interventions you should undertake to build climate resilient healthcare system in your country. So a lot of countries have started conducting vulnerability and adaptation assessment in the health sector. And I'm going to share with you in the next section of this presentation some of those countries that have in Southeast Asia that have done so. And when we talk about the facility level approach, we see here again WHO adapting the same IPCC approach that we talked about earlier. And you can see it depicts how hazards will reduce the facility's level of performance and capacity. So that's the left axis. And the level of resilience, which is on the right axis, will tell you whether the facility will recover to its pre-event state, where it was before the disaster, recover but to a state worse than before, or even collapse and not recover, or recover and attain a level of resilience greater than before the event and then transform. So this is how we see the resilience of health facilities after an impact of climate change. And this is the framework for health facilities, building climate resilient and environmentally sustainable healthcare facilities. As you can see, in this framework that they released for health facilities, they included environmentally sustainable as part of this overall framework. And that's because we realized, and something that Ramon and Pascual, our executive director, discussed last session, is that healthcare facilities contribute to climate change, and 4.4% of global greenhouse gas emissions actually come from the health sector. And so it's important that as we build resilience, we're also not contributing more to the crisis and that we're reducing our environmental footprint. That's why this framework is more, I would say, more comprehensive, because it addresses both, not just the impacts of climate change on facilities, but also the facilities and the system's impact to climate change. And this framework provides 4 fundamental components or requirements for providing safe and quality care, and that's health workforce. So do you have adequate number of skilled human resources with decent working conditions, empowered and informed to respond to environmental challenges? And you have water, sanitation, hygiene, and healthcare waste. And that's whether you have sustainable and safe management of your wash and waste services. And energy, whether you have sustainable and resilient energy services. And it's not just about having solar power or solar panel, it can also be about energy efficiency. And then last but not the least, infrastructure, technologies, products, and processes. So this includes not just buildings, but also products and processes, supply chain, how the healthcare facility operates, all the operations that allow for the efficient functioning of a healthcare facility. So all these 4 components are fundamental for a health facility to be able to provide quality and safe care. And this can be, in some countries, in some facilities, wash will not be an issue or waste will not be an issue. It's mostly energy. But in some health facilities, like we have seen here in East Timor, both are actually crucial and struggling and are very much important to be prioritized, right? So it will, like what WHO says, it has to be contextualized to your current conditions, the local conditions. And they define climate resilient and environmentally sustainable healthcare as those that are able to anticipate, respond to, cope with, recover from, and adapt to those climate change shocks and stresses, but also minimizing negative impacts on the environment. And I want to remind all of us that health facility resilience is very much interconnected with system resilience. Even if, for example, my facility, even if I'm a private health facility and I am very much resilient, able to adapt to impacts of climate change and learn and new skills even after the impacts of climate change, if I am dependent on supplies that come from the Ministry of Health or budget that comes from another organization, right? In a larger system, so it also affects my ability to become resilient. So we have to remind ourselves that it shouldn't be separate. The way that we build resilient health systems at the national level, or the way we build facility resilience at the facility level, should always be interconnected with the way we build it at the system, the national level. And this is just a process that WHO suggests, recommends for facility level to build climate resilient and environmentally sustainable healthcare. And again, one of the important actions or steps here is conducting or establishing a baseline, and that's the vulnerability and adaptation assessment as well. As mentioned, WHO also released a checklist for health facilities to assess their vulnerabilities to climate change, and that checklist is actually very useful as a guiding star. As a starting point for health facilities. But of course, we still need to adapt it to the context of the country, same as what we did here in Timor, which I'm going to share in a little bit. So this is my second to the last sections of the presentation. I'm gonna share very briefly what Southeast Asian countries are doing to develop climate resilient healthcare. And as you know, in COP26 and Glasgow, countries committed to building climate resilient, low carbon and sustainable healthcare. And that includes 3 from Southeast Asia. And part of this commitment involves developing vulnerability and adaptation assessment at the facility and system level, as well as creating your health national adaptation plan that's based on that assessment. So Indonesia, Laos, and Timor-Leste all committed to doing this, and we hope that more countries in Southeast Asia will also do the same. In Southeast Asia, we have a couple of countries that have already actually created their national adaptation plans or health national adaptation plans. You have the Philippines, Cambodia, Vietnam, Laos, and Timor-Leste already doing policy plans and strategies for health adaptation. And in Indonesia, the government of Indonesia and the Ministry of Health have done several things on resilience, as well as on low carbon and sustainable healthcare. They recently launched a health climate change adaptation portal, which helps facilities and the Ministry of Health map which potential health hazards will happen, including climate change hazards at the province level. And then you have an ADV project that was carried out from 2016 to 2020 in Cambodia, Laos, and Vietnam, and they helped the countries conduct vulnerability and adaptation assessments and also develop their health national adaptation plans. A lot of training and capacity building initiatives were also conducted under this project. And the Philippines, of course, as we know, have a vision of a modern, resilient, and sustainable healthcare system under the Health Facility Development Plan of 2020 to 2040. They also adapted the same WHO framework. If you notice, they have the 4 fundamental components of healthcare facilities there. And then we have Timor-Leste. So Timor-Leste, we are here currently working with the WHO and the Ministry of Health to support them in developing climate resilient and environmentally sustainable healthcare in the country. So we're particularly supporting them on developing the policy and strategy for this. And part of the development of the policy and strategy is a conduct of vulnerability and adaptation assessments in 10 sample health facilities in Timor-Leste. And it comprises of representatives from the 3 different levels of healthcare system in Timor-Leste and are located in different geographical areas, so to also portray the different challenges that these facilities face. We're currently in the process of data collection and processing. We just actually finished our vulnerability assessments yesterday. And I cannot share a lot about the project yet because it's not yet completely done. And of course, as soon as it is published, we will be sharing it and launching it with the permission of WHO and MOH. But some of the learnings we have here in this project are one is the process of adapting a global tool for a country like Timor-Leste, right? And so it took a little bit of time, I think at least 2 months to adapt the tool of WHO for Timor-Leste. And we still, even though we prepared it in advance of our data collection, we still had to make adjustments on the way while we are conducting the data collection, because you really learn while doing. And it's amazing to see how a country like Timor-Leste have been doing a lot of work on making sure there is equitable access to healthcare, but also building their health facilities and system to ensure that they have, as much as they can, sustainable and resilient operations. So I'm happy to share the results of this project with you and the learnings that we have, not just on the conduct of the study itself, but the process of adapting a global approach and tool in a context like Timor-Leste. There are so many other initiatives in other parts of Southeast Asia that are happening, but I'm not able to show them all in this presentation. But I'm sure if you want more information, you can ask me and I can share some of what I know. And then this is the last part, and I'm going to end in this part, which is centering health equity in our resilience work. I wanted to end in some sort of a reflection at the healthcare without harm level, but also personally. I have only been working on climate and health for almost 2 years, but I have been involved in disaster response for many years. And so I've seen the impact side of things, not only on healthcare, but also on people's lives, communities, societies. And so it's important for me, and I guess for all of us, to realize that yes, we are all going to be affected by climate change, but we are not going to be on the same boat. Some are on yachts, some are on little tiny rafts. That means we have varied capacities to building resilience and responding to impacts of climate change. We will have different pathways and timelines. Climate resilience will manifest itself in diverse settings and contexts, and we cannot have a universally applicable approach. And our pursuit of resilience needs to be adaptable and tailored, that resonate with the specific needs of and challenges of each distinct community, facility and country. I think that's one of the main things I've learned in this East Timor project and field visit. And one of the things that I've also noticed in my 2 years of working with Healthcare Without Harm is that most of the discussions on decarbonizing health systems or building adaptive capacity rarely acknowledge that half of the world does not have access to essential health services, and that over 100 million people annually are pushed into poverty because of health expenses. And then you have a large number of health facilities that are not connected to reliable energy and water sources and are always in perpetual state of stress. So when a climate disaster strikes, it's not even a question of whether they will be able to bounce back or transform, but whether they will be able to continue delivering services during the crisis or ever fully recover. So this concept of climate resilience in healthcare for me goes further and beyond adaptation of infrastructure, supply chain, or health workforce. It's actually, for me, addressing the systemic issues of inequity and justice. At Healthcare Without Harm, we have been in the process of strengthening our work on resilience, and that includes developing some sort of a vision for climate resilient healthcare. This is a work in progress, but I wanted to briefly share with you what we are working on so far. We will be sharing a full brief about this, but we see climate resilient healthcare having a proactive and innovative mix of adaptation and mitigation strategies with health equity at the center. I'm not saying that you have to do both at the same time or else you're not going to be climate resilient, right? There should be a balance. Some adaptation work will not be low carbon or sustainable, but they're necessary for the system to grow and expand and also build its resilience in the long run. And that's totally okay. That shouldn't be diminished as part of an adaptation action. But what we're saying is that we have to be proactive when we see that there is an opportunity to mix these strategies together. That will give us a better result, effective result as a facility, as a system. We also see collaborative and multi-sectoral approach as an important aspect of climate resilient healthcare. That again, it has to be tailored to local vulnerabilities and contexts, that it has to be inclusive and community-centered, that we prioritize our health workforce because they will drive the work, and that we have adequate and sustainable financing and resource allocation. So again, I'm going to share this brief with all of you as soon as it's available. And last slide for me is just an adaptation of some of the work that our colleagues from the US are doing with their communities and healthcare facilities there. And I think it's very relevant to this last part of this session, which is how and why we are doing this matters just much as what is being done. And these are just some recommendations that I leave with you. It's important that we build with and not for, that we share that table with our stakeholders, our communities, our healthcare workers, that it's okay to start on existing activities. We build on them. We don't have to start from scratch, from new things to actually build climate resilient healthcares. That it's important to share, develop a shared set of values and commitments with your community stakeholders, with your health workforce in your facility, and that it's important that we commit publicly. It will also help us successfully achieve those goals that we have, whether it's to develop low carbon sustainable healthcare or climate resilient healthcare, and that we need to break down the silos. And this is why we think that mixing or having that balance of adaptation and mitigation instead of separating them will actually yield us some better results, and that we always have to advocate and spread the word, not just around our communities, but maybe at the national level, regional, global level. And that's it. I hope that you learned a little bit about resilience and adaptation in this lecture. And if you have any questions, I'm happy to answer them. Hopefully, I will have a better connection. Thank you so much.
Okay, thank you very much, Jit, for that very comprehensive lecture on adaptation and resilience in the healthcare sector. I'm not sure if you're around and if your connection is cooperating, but it will be great to have you engage in a quick Q&A. I already saw that you're answering some of the questions. I'll be asking them once more so that your answers will be captured in the recording. Thank you, Jit, for putting all of us on the same page in terms of the definitions: resilience, adaptation, risk. You showed to us several frameworks from WHO, from the IPCC, and of course, the real world examples that you showed to us, healthcare systems that were unresilient, but also ongoing efforts in, for example, assessing vulnerability and creating resilient strategies in Southeast Asian countries, for example, in Timor-Leste, where you're currently at the moment. And then I really appreciate your finale when, one, you address that kind of perceived tension between adaptation and mitigation. And it connects to the earlier talk by Mon last week. In a way, what you're conveying is we really don't need to choose just one and ignore the other. We need to find those synergies in the middle. And thanks for emphasizing health equity, which is very important, central to our work in building climate resilient health systems. So I just summarized your presentation, and now I'll just ask a few questions before we move to the case study. And there's one question, and you already answered it, but maybe you can repeat your answer and expound a bit more. The question was, has healthcare without harm directly interacted with the government? And I think it's pertaining to the Philippine government, but also other Southeast Asian governments. For example, you're now in Timor-Leste. When it comes to risks, vulnerability of the health sector, and what are the recommendations that have been generated so far as you interact with these government agencies? Jit?
Thank you, Doc Renzo. Thank you for that question. I know I answered the Philippine side of it, but I wanted to share some of the work or some of the initial recommendations that are coming up already here in Timor-Leste. And we see, Timor-Leste is one of the youngest countries in the world. It's been 20 years since they became a country. So there's a lot of challenges in the country currently, not just in the healthcare sector, in the health system of the country, but overall as a country, there has been a lot of challenges, but they are addressing it. And they are on that journey. So right now, they are still, most of the facilities here don't have access to clean water supply. Most of them are using groundwater, and only the National Hospital has filtration system. The rest of the hospitals and healthcare facilities in the country have no filtration system. So there's no potable drinking water in the hospital, for not just for the patients, but also for the staff. And you can imagine also energy. Electricity here, they experience a lot of power outages regularly. And so health facilities rely heavily on backup generators. And then if for primary healthcare facilities that have vaccine refrigerators, they don't have backup generators. So every time that there's a power cut or power outages, they would bring and transport the vaccine to the health center, the community health center, which in the Philippines, that will be like the rural health unit, where they will have a small backup generator, just to make sure that they don't lose their supply of vaccines that are important for that community. So, and then you talk about waste. management in this country. Right now, there's no sustainable waste management here, and they're all open burning and incinerating their waste. But it's also impossible right now to tell the government of Timor-Leste, hey, that's not sustainable, that's not environmentally friendly, stop all of that, right? It's really difficult and challenging for a country like this who's experiencing a lot of challenges, not just in the health sector, to transition away from that immediately. So we have to have this balance of right now what's working, we continue what's working, and then slowly build on the sustainability of that system, and then build the resilience of other systems that we can build right now, whether it's on WASH or in energy or training of the health workforce to be able to be more engaged and more empowered in addressing the impacts of climate change in the facilities. So I hope that answers a little bit about the question and gives a little bit of a look of what is happening here in the work that we're doing in Timor-Leste. But some other countries that we work with in the Philippines, we work mainly on the low carbon and sustainable side, but also in Cambodia, we also work with them on the vulnerability and adaptation assessment for clinics, small clinics, not really the government. So,
right. Well, Jit, that's a very comprehensive answer. And I think one lesson that can be gleaned from that statement that you just gave is that different countries are in different phases and states in the journey towards climate resilient and low carbon health systems. And
yes.
you have countries where the essentials, the basics will need to be put in place first, like Timor-Leste, as you've described. Philippines, for example, we're probably somewhere in the middle. And when you were talking about healthcare waste management or waste management in general, not yet existing in Timor-Leste, I'm reminded of what we have in the Philippines. For the past 20 years, we have an Ecological Solid Waste Management Act, and this law still is yet to be fully implemented and properly implemented in this country. So you have a country where there's no system, and you have a country that does not follow the system that has been agreed upon through legislation. And so it's very important to really diagnose where the country is and to come up with strategies and recommendations such as the ones that you mentioned. And a while ago, you also answered in the chat box that you've been working with the Department of Health in the Philippines. There is a policy for green and sustainable and resilient hospitals. So that's one example also of perhaps an existing tool that can be transplanted to other contexts, such as Timor-Leste. And this will encourage more regional cooperation in terms of advancing this agenda, which now leads me to the other question. There was a question about, since the countries of Southeast Asia are more or less facing the same risks, climate risks, also having the same vulnerability, although you showed some maps where there are countries that are more vulnerable than the others. The question is about, is coming up a more regional action plan for climate resilience in the health sector is something that we should even be considering, for example, at the level of ASEAN, the Association of Southeast Asian Nations. Any thoughts on that, Jit? Jit, you're muted.
I think, Dr. Renzo, that's a really good idea to explore. I don't know if like a climate resilience plan for healthcare sector for ASEAN would really work, but I think a cooperation strategy, right? I think we can all learn from each other. Like you said, the Philippines' journey to having that vision of modern, resilient, and sustainable healthcare can maybe apply to Timor-Leste, right? I think a cooperation strategy at the level of the health ministerials at ASEAN would be a good idea to explore. A lot of learnings from Vietnam and the Mekong region in terms of climate resilience. They're kind of ahead of us really in the Philippines and Indonesia. There's so much to learn from them. And it's not really available online or anywhere. So something that we have also been developing at Healthcare Without Harm Southeast Asia are just compiling all those case studies of different contexts of different systems and facilities and putting them together, and not just talking about what they achieved, but the process of achieving it, because I think we will all benefit from learning from each other in this region. Perhaps even sharing resources, not just technical resources, but perhaps even some of countries might perhaps even share some financial resources for countries that are struggling in developing resilient health systems. And you have Lao PDR, Indonesia, and Timor-Leste having this high commitment at the attached level, the ministry level. That's also a really good opportunity of sharing a community of practice of what they are learning from this journey that they have that has high level of commitment and achieving vulnerability and adaptation assessment at the national level and adaptation plans at the national level for health, and sharing that with the rest of the region would be something I think that will be useful. Those are my thoughts about it, Dr. Renzo, and thank you for the
Great.
question, Diane.
Great. And thanks also for highlighting that there are countries that already are making commitments at the highest level. But as we also know, unfortunately, in ASEAN, I think is it only Malaysia that has signed up for the ATACH program, the Alliance for what is that? Alliance for Transformation in Climate and Health of the WHO, which basically asks ministries of health to make a commitment to build low carbon and climate resilient national health systems. What is the update on that?
Actually, we're right now, we have been holding some meetings. There are several working groups under the attach, and Healthcare Without Harm is actually co-chairing the working group on low carbon and sustainable health systems. And then we're also attending and members of the climate resilient health system. So what is happening right now is really having lots of meetings with these governments and the partners who are already working in this space to gather what are the approaches that are already there, tools, resources that can help these national governments, putting together all of them in one place so that they're easily accessible, and then organizing access to technical resource within each of the regions that countries can easily access so that they can implement those and achieve those commitments that they have. There is a plan to have community of practice website and also platform for all of these governments to learn from each other and share their experiences. And so we are at the last stage of the planning. And then some of the governments are already in the process of implementing those achievements. Like Indonesia is already working with the WHO on the vulnerability and adaptation side of it. They're also working with us on low carbon and sustainable health systems. So baselining their GHG emissions in the health system of Indonesia is also in progress. And you have Lao, there's a Green Climate Fund proposal that's on the way to implement those initiatives that they have under their attached commitments. And then you have the Timor-Leste project that's ongoing right now. So there's a lot going on at the same time, and WHO is kind of helping facilitate technical resources and also identify where they can access financial resources.
Wow, excellent update. There's a lot of things going on indeed, and certainly more are yet to come. Especially that we are we still have around 360 co-learners in the room learning about climate resilient health systems, and hopefully they will be applying all the learnings in their respective context. I'll just ask two more short questions, and then we'll go to the case study. You mentioned already that it's not just about the transfer of technical expertise, but we also know that there's a role for technical experts, consultants, for instance, to be supporting countries on the road to climate resilient healthcare. There are three questions that are asking basically the same thing. What is the role of the community, right? How can we engage, the community? For example, there's one specific question pertaining to maybe some of these jargons, right, or tools may be less, appreciated at the community level. So how can we engage meaningfully communities in resilience building? And make sure it's a successful journey. Any thoughts on that, Jit?
That's really one of the hardest things to do, to be honest. Right? Sometimes we just develop plans with we've seen so many times in the past, the plans are not developed with communities or not considering community needs. And I think when adapting some of these approaches and tools at the community local level, what has been, at least for our learnings in doing it in both in Cambodia and here in Timor-Leste, is that it's important to have that understanding of the local context. You cannot just go in and say this is what WHO says. Even if it was WHO who could actually contracted us to do this and told us to apply the WHO approach, we said we need to understand first what these health facilities are going through, what are the challenges in these communities before we can actually use this tool. The tool that WHO has, for example, has 300 questions in one checklist for a hazard. A primary healthcare facility that has 5 staff will not be able to answer all of that. And so understanding what will work for those communities, the local language is so important. And we actually learned a lot from this initiative, that even though we had it translated, it still was different when you actually ask the questions to them. It will have a different meaning. So having a local person with you, a community person. So in our case, we had the WHO public health officer that's assigned in that area, that's from that area, join us in the vulnerability and assessments that we've done, so that we have someone who's able to actually ask the questions in a way that will be understood by the community health workers. And not just us from a foreign country asking a question that's not relevant for them, right? And so that's I think those are important. And then when we develop resilience plans or adaptation plans or any initiatives that we conduct as a facility, there's so many learnings from our GGHH members, Global Green and Healthy Hospitals members, that will actually show you how community engagement in both low carbon sustainability, also climate resilient work, actually yields a lot of health benefits for the community, and also improved community resilience, right? We have pictures of the Buddhist Chuchi in Penang, dialysis center in Penang, Malaysia. I showed in one of the slides that I have that they are engaging not just with the patients that they have in that dialysis center, but with the community of where they are located, right? So most of the patients that they have are kidney patients, those with chronic kidney diseases, right? And so what they're doing is promoting plant-based diet in the community so that you address and prevent the occurrence of chronic kidney disease in that community, in the population, less diseases in the future, right? And so that's one way of making sure that not just you as a facility is able to respond to impacts of climate change, able to provide the care that your patients need, but also you're improving health resilience of the community. And I think if we have that in our minds, not just in in providing the care, but also planning our activities, health promotion in our facilities that will yield us better results and also benefit our communities. I think it's important to think of who are we doing this for, right? And not just what is it going to do for my facility, but what is it going to benefit my community.
Thank you so much, Jit. Last question. And this is in relation to your situation at the moment. Your internet has been very resilient, your connectivity. And there's actually a question about the role of communication, interconnectivity, even digital health. Are these things also part of resilient health system building? Because I think you probably just mentioned it in passing. Any comments? Jit? Yep.
Sorry, Doc, I didn't hear the question.
And it's so funny because I made a remark about your resilient connectivity and it failed us for the first time. My question is, is there a role for communication, internet connectivity, digital health in making sure climate health systems are climate resilient and also universally accessible, especially in hard to reach populations? And you're muted.
Absolutely, Doc. I think it's important. It's important for internet connectivity, not just for providing communication to communities, but also one of the things that we saw in Timor-Leste is that most of their records are on paper and written, and they don't have backup, not even like on their computer. And it's because there is also no sufficient energy supply, no internet connection. And so when flooding happened in one of the facilities, all of their supplies were gone. So that's information and communication systems. Access to cloud and backups for this are important for healthcare facilities if they can. But also communication for when for doing health promotion in the communities, it's also useful. And also communication among the staff. Most of the health facilities here in Timor-Leste are using WhatsApp groups to communicate with each other. For example, there's an earthquake that happened in Maubise, in one of the areas here in Timor-Leste that are prone to landslides. If there's a landslide that happens and I'm not able to reach that hospital and I'm needed there, you can inform your colleagues, your staff members that to be able to make sure that, hey, you need to go on and take my shift, for example, so that we can have enough staff covering the facility right now during this crisis. So those are really important and in different aspects of the work in the facilities.
Brilliant. Thank you very much, Jit. So now we'll pause for a bit and hear another case study, this time from one of our colleagues, also from Healthcare Without Harm. She is a researcher in the Healthy Energy Initiative in India. So joining us from India is Nitha George, again, who will be presenting a case study. Nitha, thanks for joining us. And you can now share your screen.
Thank you. Thank you, Renzo. Once again. Okay, I hope it's visible.
Yep.
Hi,
maybe
hi
you can
everyone.
maybe you can just press the full screen button. Thanks.
Yeah. Thank you. So one second. Okay. Hi everyone. Thank you, Renzo, for this introduction. I'm Nitha George. I'm working with Healthy Energy Initiative India. It's a program of healthcare without harm. So I'm mainly leading the climate and health policy work in HEI India. So moving on to the topic, I'm here to present a small study from India and from the state of Kerala. So as we know, climate change and extreme weather events are increasing, and they pose a great threat to our health system. And it is very important that our health system is prepared and resilient to these extreme weather events. So, at the same time, the impact of the climate change vary from geography to geography. So it is very important that we need to have a climate vulnerability assessment in a region, so that we need to understand what climate threats are posing to each facility or facilities in a particular region. So moving to the state of Kerala, in 2000, okay, I'm from state of Kerala. In 2018, we had a massive flood in our state. And post-flood, the Directorate of Health Service has estimated nearly 120 crores of losses, especially to the government hospitals alone. And some of the districts were worstly affected. Ernakulam, Pathanamthitta, Thrissur, and Alappuzha were the few districts that was affected very massively. And there the hospitals was completely flooded. Some of the hospitals was completely flooded, and they have to evacuate the patients. They have to suspend the surgeries, and all critical services were paused at the moment. So at this point, it is very important for us to understand what are the vulnerabilities in each geography are facing. So this assessment is a very simple exercise, and it is very cost effective. And this climate vulnerability assessment, we have incorporated into a state action plan of climate change and human health in state of Kerala. So moving on to the assessment, and this is a report we have developed out of our assessment. And we have done our assessment in Idukki district of Kerala. It is one of the 14 districts in the state of Kerala. It is a very hilly region with very dense forest. And our state's 66% of the power generation, we depend in hydroelectric projects in Idukki. And since a hilly area, most of the people, their occupation are tea plantations, coffee plantation, and they are daily wage laborers, and they depend largely on the government facilities for their health needs. And this district has more than 7 rivers, and 2 of them are very major rivers, and they have 18 reservoirs in the state. So according to the district is prone for earthquake, especially from Jan to December, and for drought from March, April, May. And March, April, May, it's a summer season in Kerala. And the season we are prone to drought. The district is prone for drought and wildfires, lightning from Jan to June. And June and July is the monsoon season in Kerala. So floods, cyclones, and landslides are very common in these months. And epidemics from summer season, from the beginning of summer season to end of the monsoon season, we have epidemics here. And the district is prone for water and road-related accidents. So we have conducted this assessment in total 4 hospitals. So we conducted this assessment in a primary health center in a place called Chakkopalam, and a family health center in a place called Kumali, and a community health center in Vandiperiyar, and a Taluk hospital in Perimedu. So the compiled report had the findings of the 4 hospitals. So since we have a time limit, I'm presenting a story from one hospital. So initially we developed a climate vulnerability checklist. So we developed customized this checklist from WHO, a tool for climate vulnerability, where we focused on 2 aspects mainly. First, on the infrastructure vulnerability, and on the climate sensitive disease vulnerability. So in the infrastructure vulnerability, we try to understand what are the past experience of extreme weather event. For example, has the hospital been affected by flood, landslides, or cyclone? If they are affected, what are the damages, especially to the infrastructure or to the service delivery? And what preparedness the system has taken to tackle these impacts? And when it comes to climate sensitive disease vulnerability, we try to understand what are the common climate sensitive diseases has been reported in the facility, and what are the preparedness measures the hospital has been taken. So this is one of the hospital where we do our assessment. It's community health and Vandiperiyar. So you can see in the picture this facility. It's very accessible to the localites. It's like 1.4 kilometers from the Vandiperiyar town. So the road in front of this hospital is the national highway, where near to the Idukki district, we have a district known as Pathanamthitta, where we have the Shabarimala temple. Thousands and thousands of pilgrims travel every year through this road to reach this Shabarimala. And this is like a very common route taken by the travelers. And this hospital serves the Vandiperiyar Panchayat. And you can see in the picture, there's a small canal running in front of the hospital. And this canal reached the Periyar River, which is one of the major river in this district. And behind the hospital, there is a small tea plantation. So this hospital is total of 1 acre of land, and they have like 3 administrative block, 3 hospital block, one for the staff quarters and admin and OP block, and one is IP block. And they serve more than like 43,000 people, and of which 200 are tribal people. And they have an OPD of 500 patients per day, and with a bed strength of 84, and they work 24/7 hours. They have an ambulatory services. So once we went to the hospital to do our assessment, the medical superintendent and the nursing officer were the prime respondents to our assessment. So we try to understand the infrastructure vulnerabilities faced by the hospital. So, so based on our questionnaire, we were able to understand the hospital has faced flood, thunderstorm, and landslides very commonly. So this is a canal running in front of the hospital. So flooding is the main issue faced by this hospital. Every year when it's rained, this canal get off. The landslide happen inside the forest. So water from the forest, they come through this canal and they drained in the Periyar River. So mostly what happened is when it's heavy rain, the river gets flooded, the water gets black flowed to this canal, and the hospital gets, the water entered in the hospital premises. And you can see a small connecting bridge between the road and hospital. So during rain, the waste which is accumulated inside this canal, they get clogged in the pillars of this connecting bridge, and the water gets stagnated there and it entered to the premises. And the since it's like a very common route used by the pilgrims and travelers, what the public work department they do is they raise the height of the road, so the water is not entering into the road but it's backflowed into the hospital. For the water from the tea estate to drain into this canal. So if the water in this canal gets flooded or this channel gets flooded, they enter into the hospital premises. And this is a very old hospital, and Idukki, the Vandiperiyar is a rural area, and this hospital is really old hospital, and they have a connection for the wastewater to flow outside. So what happened is when the water enters from these channels into the hospital premises, through this opening, this water enters in the hospital, inside the hospital. So far, there was no injury to staff or to the patients, but the hospital service delivery infrastructure was highly affected. And these, you can see the damages. I'm trying to explain the damages and impact of this infrastructure. In the picture, you can see there are marking of the dates and years. So this is the water level that has been marked by the hospital staff in every year. So 2018, there has a flood, and we marked it 2019, 2020. These are the water level in each year. So what happened in 2018 flood is that was the worstly affected flood, and the staff has no prior alert for the flood. So water enters in the hospital like 5:30 in the morning. The ground floor of it's a 2-floor building. The ground floor was totally submerged, and the impact was so high. The building infrastructure was affected, the office equipments, the medical equipment, medicines, records, all these infrastructures were affected. And this hospital has mainly two wells in their premises, and that was used for the drinking purpose, and one is for the other purposes. This well was completely submerged, and you can see the walls of this building. These damages was caused by the flood happening in the hospital, and service delivery was also highly affected here. So what happened is in 2018-19. So when the water, the hospital staff, they literally have to see the level of water in this canal. So when the water in the canal level increases, they disconnect the electricity connection to the hospital. And as of course, there are snakes and scorpions are seen in the hospital premises during flood. And in subsequent flooded, compared to 2018 flood, the damages were minimal in 19, 20, and 21, and recently in 23, where we done the assessment. But hospital was impacted in these times, and many times the staff a few staffs were unable to do the duty, and patients, and because of this flood, the patients were unable to reach the hospital for the services. So I try to understand what are the preparedness the hospital has taken to tackle these floods. But we were able to find that the hospital has no documented disaster management plan, or whatever they are trying to resolve the issues are all from the past experience of the staff. So there was no institutional recall of the memory. So once if you lose the staff from the hospital, you have no record of what are the steps they done to, what are the disaster response measures they have taken at the time of flood. And few staffs are living nearby the hospital, they are able to come to the hospital at the time of flood. And currently they have a rapid response team with a medical officer at the head, and a staff nurse, a health inspector, and an attendant. So what you can see in the pictures is like already they are keeping their equipments, their fridge, their vaccine storages, everything on a top of the table, because anytime if it's rain, the canal gets flooded and water is entering into the hospital. Even the impact can be large or minimal, but still the water is getting enter into the hospital. So they have kept all medicines and equipments in the chair. So if the water is increasing above this level, they are shifting this equipments to the top floor of the hospital. So post flood in 2018, they have raised the height of this well. What you can see in the picture is the well. I was saying they have raised the height of the well, and they covered with a concrete slab. And power outage was a main issue in the rainy season. So they have an inverter and a diesel generator with a backup fuel of 50 liters. So in 2018 flood, they had faced issues of power outages. Even though they have generators, sometimes the backup fuel is not adequate. So when they try to get the fuel from other places, the roads this is a hilly area, you have all the hairpins, the roads are blocked with the flood, so you cannot go any place. And they have covered the hospital equipments with they have covered with insurance, and they get renewed in an yearly basis. So in the post-flood, all staff, they work together to make this hospital back in the normal condition, and they get support from the local youth group, villagers, to clean the hospital. And they have given prophylactic medicines to the volunteers who are working to prevent leptospirosis. And they were able to coordinate between the health department, fire and police department, and they have a referral services to the nearby Taluk hospital. So this is the case of infrastructure damage, and we try to understand what are the climate sensitive diseases faced by this facility. So we were able to understand that respiratory diseases are very common in the winter season, and sporadic outbreaks, diarrheal diseases are reported once in 3 months. Dengue cases are reported, especially in post-rainy season and in rainy season. In winter and in rainy season, bronchial asthma, bronchitis, and breathing difficulty cases are high. And especially in rainy season, the cases of snake bites, scorpion bites are getting high. And they also receive cases of dog bites, cat strike, snake bite, wasp, and honeybee stings, etc. But rainy season, the snake bites and scorpion bites in the area are reported high. And post-rainy season, PTSD, post-traumatic stress disorder cases are also reported. And in summer season, cases of urinary tract infections are also reported high. When we try to understand what are the preparedness they have taken to handle these diseases, so far the hospital is able to handle the cases or the patient's demand so well, and they were able to provide training for the staff, but the hospital doesn't have any contingency plan if in case the cases are getting high. So they have no written emergency response or contingency plan to handle these diseases. So these are some of the very key findings from our assessment in 4 hospitals. So in total 4 hospitals where we have done assessment, most of the hospitals have affected by extreme weather events. They have infrastructure damages, long power outages with no electricity backup. Certain no diesel generator too. So they have no electricity backup during heavy rains or flood. And in some hospital, water shortage was the main issue. and the hospital has no standard operating procedures or written plans for disaster response. And the staffs are not having adequate treatment, and it was difficult for the patient as well as the staff to access the hospital. And during rainy season, there was uprooting of trees, and safety of the medical personnel and patients who are inside the hospital was also a question. And there was lack of coordination between the district disaster management authority, this hospital during extreme weather events. And from our assessment, we recommended to the hospital that the hospital should be or the hospital who face these vulnerabilities should be retrofitted immediately, and they should be having a standard operating procedure, and the staff should be trained adequately on disaster preparedness and response. So diesel generator was not a sustainable option. So possibility of renewable energy should be opted to provide uninterrupted electricity supplies. And for the hospital which face the water shortage, rainwater harvesting facilities should be there, and the hospital should have a contingency plan, and that should be prepared in coordination with the local self-government, the district disaster management authority, fire service, district medical authority, youth and civil society organization. And we also had given few recommendations to the state to do climate vulnerability assessment across the state, and the hospital which is vulnerable to these extreme weather events should be retrofitted, and disaster specific response training should be given to all medical professionals. And the hospital must have a disaster management plan. And in long term, the state should see the state should transform all its health facility to renewable energy, because that is clean, reliable, and sustainable. So once we complete our report, we had a follow-up meeting with the stakeholders. We on March we tried to hold a meeting. We hold a meeting between health department, the local self-government. So where we explained our report to the LSG authorities, and a lot of support was offered from the LSG at the point. And one interesting fact we heard from the local self-government is they are not much aware of these issues faced by the health facility. And I wonder, we had a conversation with the block panchayat president, and they're highlighting at many times they need a person to initiate the conversation between the departments. So at this point, for us to reach the health system resilient, interdepartmental collaboration is so important. So once we had this meeting, Panchayat was offered support in retrofitting the hospital, assistance in retrofitting the canal in front of the Vandiperia hospital. For the hospital who are facing water shortages, they are sure they'll be able to provide rainwater harvesting in long run. So, and the medical officers also explained the necessity for having the hospitals to be solarized. And in June 15, we released this report with the district collector, Ms. Shiva George, IES, in the presence of the district medical officer, deputy DMO, and DPM. So in the long run, we are planning to share this report with our health minister, health secretary, and NHM director. So I would like to conclude this case study. It's a very small, simple exercise where we do in one of our districts. So I would like to say that it's like a first step for building climate system resilience. It is like very simple exercise where you can do with a checklist and understand the vulnerabilities of your hospital. So health systems in health systems are not just merely the providers of health services. They are like they build resilience. They have to be resilient. So they build resilience of the community so that they provide equitable health services to all the people, because not everybody are not all the community are privileged, or not all the community can afford or private hospital at times. But the government facilities are very important in the country to be resilient. So thank you. If you have any questions.
Thank you very much, Neetha, for that very informative case study. I think what's important is that our co-learners have seen or witnessed a work in progress, right? Because resilience building is not, does not happen overnight. And you emphasized and you demonstrated how a climate vulnerability assessment is done And you also showed how multi-stakeholder engagement is very important. It connects to our earlier question about the role of the community. There's someone in the chat box saying consultations with affected communities is critical in the process. And then I really like also what you said in the last slide, that resilient health systems are the foundation for broader societal resilience, which is what also Jit mentioned a while ago. And so, it really speaks to the leadership role of our sector. There are several questions in the chat box related to your case study. Also, I'm inviting Jit, if she's still around, to join us in a conversation. And the first question is about relocation. You've been mentioning that the recommendation for the hospitals that you assessed is retrofitting, but where is relocation in the plan? Is it something you even considered, or if not, why is that so?
Thank you, Rancho. That's very important question, because that was the first question that comes to people's minds when we talk about health system damages because of extreme weather events. It's easy to say relocation, but many times the hospitals are not accessible to people when we relocate. So the hospital have to be accessible to people, and at the same time, it's more cost for the relocation. So if we are able to retrofit the existing hospitals, it's more budget friendly, and also at the time it is more accessible for the people to come to the hospital. So relocation is an option, but if we have a possibility of retrofitting, we should highly recommend retrofitting of the hospitals.
Excellent, thank you. There was a comment or a question rather. Are you conducting disaster drills in the hospital? And it also relates to another comment saying that disaster management and preparedness must be included in the training program of health personnel. Is that something already happening?
Disaster management, it's very important to have disaster management training. In our disaster management, every hospital should have a disaster management plan, and the staff should be adequately trained on disaster response. Currently, disaster, if I say in context of state of Kerala, disaster-based trainings are happening, but I'm not sure to what adequate level the training are happening, because there might be training happening at the district level, but not to all the medical professionals who are working in the remote areas, or all the for example, if we have a training at the district level for medical officers, what about the staff nurses and the other staffs? Like at the time of disaster, all the people in the hospital should be able to provide their services at the moment. Like they should be able to work together. So we should start our training from the grassroots level. Trainings are happening, but the training should be from the grassroots level.
Thank you, Nitha. And in the Philippines, for example, such disaster drills are already being conducted, but I think it's high time for, let's say, countries like the Philippines to actually evaluate, is the approach, the method actually effective? Or
Yes.
are we conducting again and again these simulations, these workshops, but then, for example, we still have huge human toll of this disaster. So again, it's both teaching and training, but also revisiting and evaluating.
Yes.
You also mentioned that there are no contingency plans in the hospitals yet. There's one comment: hospitals should have business continuity plans. And we also
Yes.
realized that during the pandemic, whether it's due to
Exactly.
climate shock or pandemic impacts, hospitals, healthcare systems should have a plan B, plan C, generators, backup, internet connection, among others.
Yes,
There's one
definitely.
question about flooding. You also showed some pictures where, in the wall, you can see where is the level of flooding in the most recent calamity, and what are some infrastructure solutions to resolve flooding problems of hospitals? Is it just about, for example, moving the essential services to the second floor, right? And up to which floor are we moving our services to make sure that our health facilities are flood proofed? Any comments on that, Nitha?
And actually, it's a very important question. Last year, we have documented a study in Kerala, from Wayanad district of Kerala, where the hospital was completely flooded in 2018 flood. But with the leadership of the medical officer, they were able to retrofit the hospital and make it resilient. So I'm just saying, I'm just quoting a few examples of the steps they have done in their hospital. So as you said, it was not easy to how many floors we'll ship the equipments, but this hospital, what they have done is like they have made a channel for the water to flow, and they have raised the basement of the hospital with the pillars. And this hospital has no ramps for taking it to the first floor. So they created a ramp. So in case of emergency, they can shift it to the first floor. And they plant more trees in the premises. So the force of the water is reduced. And they have a small canal in the hospital premises from the water from the other areas coming inside. So they planted bamboo trees in their premises, so the water flow is reduced. So they put a channel for the water to flow into the other direction. So these are like very few and simple things that can be done, but a more detailed consultation with the district engineers can give us a more appropriate measures to build our infrastructure resilient.
Thank you so much, Nitha. It's interesting because in the chat box, some colleagues or co-learners are giving some, real life or real world examples of how, for example, hospital construction went wrong because of ill planning and lack of foresight. And I guess that is also something that the health sector must develop, being able to foresee what's happening in the next 10 years, in the next 20 years. And that requires knowledge of climate change, and that's why we are having this course, so that our health professionals in the region are all equipped and aware about what is yet to come in an era of a warming planet. There's one question, and I'm not sure if Jit can still join us, but it's interesting because in this particular session we have two women leading health system resilience building in the Philippines, in Southeast Asia, and of course, you, Nitha, in India. Any comment on the role of women in mitigating climate impacts? And maybe another question related to that, how can we apply a gender lens to this work?
I think it's very important aspect because I'm sure whether I answer it rightly, but from my experience working close with the community and with the medical officers, there is more perseverance with the it's very important that the medical officer of a particular facility has adequate leadership to make the hospital resilient, because many times with the interest or leadership of a single person, the hospital has entirely transformed in the post-flood phase. But that doesn't happen with other hospitals. So leadership, to answer your first question, leadership is very important. And a role of women, I think I can answer more in a community perspective, because when we go to a community to talk to the people about a community resilient aspect, women in the house is more responding to these things because they consider their livelihood, their house, their culture to be preserved at first point. So I think gender aspect, when we approach at a community level plan or something, when you go to the community, there is more positive approaches from women comparatively to men. So for example, we have a program working on coastal with the coastal people. So there are coastal erosions and coastal flood happening. So when we go to the places and talk to the women over there, they stand first to protect their house, about their protect their land, their house. So I think gender role is, we have a clear gender lens. I think certain community aspect we can see from a gender perspective too.
Great, Nitha. I think Jit wants to add something, and I'm unmuting her now.
Thank you, Dr. Renzo. I just wanted to add a brief answer to that women play a very significant role as caregivers, and most of the time they are, I believe there's a a study on how many percentage of women are actually as healthcare workers. I think it's more than 50%. I don't know the exact
Mm.
number. And they are also community leaders in many societies. You see that in primary healthcare facilities. Even in the Philippines, barangay health workers are mostly women. So they have valuable insights into the healthcare needs and priorities of not only their families, but the community. So that's how important involving women in the not just the decision making process, but also in the planning and implementation of those initiatives. Also, climate change, as we know, affects women and men differently, right? Because of gender inequalities. So involving women in our initiatives, especially their specific needs and perspectives, will be able to understand and better prepare adaptation actions that better respond to their challenges that they face.
Excellent. So, you know, our healthcare workforce is highly feminized at all levels, and also women and and children are certainly vulnerable to many of the impacts of climate change. You know, our pregnant mothers, for example, how can they give birth when birthing facilities are destroyed by typhoon? Or they also get exposed to sexual violence, for instance, in makeshift or temporary evacuation centers after a disaster strike. So those are just some of the many health impacts disproportionately faced by women in climate affected areas. I think we can wrap up now the session. We have already asked both Nita and Jit a lot of really important and stimulating questions. We already started touching on leadership, the leadership of women, but the leadership of local leaders. And our session on Thursday, the last session of this course, will focus on the leadership and advocacy role of the health sector. It will be our opportunity to bring all the ideas, the learnings from the past 7 sessions together and equip ourselves on how we can make a positive difference in our healthcare organizations, in our communities, in our countries, and even for the entire planet. And, you know, leadership is very important. I noticed that several of you were citing petty politics, corrupt politics, bad politicians as barriers to resilience building. And hopefully next session, we will explore how we can be the effective and, upright leaders that we can be in order to usher the transformation that we want to see within the healthcare system. So, wow, it has been another fruitful discussion with lots of examples, great ideas, concrete recommendations, and food for thought. I know it's dinner time for most of us based here in Southeast Asia, but hopefully this intellectual nourishment was sufficient to allow you to survive this evening. Again, thank you very much. Stay safe and see you on Thursday for the last session of the Southeast Asia Climate and Health Responder course brought to you by Columbia University, the St. Luke's Medical Center, and Healthcare Without Harm, Southeast Asia. Thank you, Jit and Nita, for your time. Thanks to all of you. Take care and see you.